The ordinary circulatory strain of a grown-up is 120-80 mmHg. Mercury circulatory strain 130 to 139 80 to 89 mm. On the off chance that there is mercury, it is called stage 1 hypertension or first stage hypertension. However, assuming that it is more than 140/90, it is called stage 2 hypertension. On the off chance that somebody's pulse is more than 139/89 in a specialist chamber or circulatory strain estimation, and it happens multiple times in succession, then you ought to realize that you have hypertension. Notwithstanding, there are a few arrangements to be made before circulatory strain estimation. Circulatory strain ought to typically be seen following 30 minutes of sitting unobtrusively in the clinic. Try not to smoke, talk and show fervor during circulatory strain estimation. In the event that hypertension is identified at the degree of 139/89, the initial step is to roll out certain improvements in way of life without drug. For example, going for standard strolls, following a decent sound eating regimen, staying away from overabundance or overabundant salt, smoking suspension and so on. In the event that pulse is still high notwithstanding way of life changes and there is a family ancestry, lower portions are given at first. Particularly assuming that somebody has diabetes, coronary illness, kidney confusions, pulse control drugs are begun immediately in stage 1 hypertension. A big part of individuals matured 60 and over and 1/4 of grown-ups have hypertension. A large number of them don't realize that they have this issue. Accordingly, customary pulse estimation is fundamental for everybody. Assuming you have hypertension under 40 years, it ought to be checked whether there is some other explanation for it. Different prescriptions, steroids, torment drugs, discouragement meds, contraception pills, kidney difficulties, pregnancy, hormonal awkward nature, adrenal organ issues, Cushing's condition, pheochromocytoma, thyroid or parathyroid issues, pituitary organ issues, weight and so on. Reasons for hypertension. Hypertension is known as the quiet executioner. 2 mm than typical. Hypertension expands the gamble of death. The gamble of cardiovascular failure increments by 7% and stroke by 10%. Uncontrolled pulse can prompt unforeseen demise from stroke, coronary episode, cardiovascular breakdown, kidney intricacies, cognitive decline. In the event that not treated routinely and uncontrolled, a few changes in veins and kidneys will increment circulatory strain. This is called safe hypertension. Then, at that point, control with at least 4 medications. Pulse is normally monitored at 130/80 mmHg. Or on the other hand is intended to be kept near. The specialist endorses hypertension medication in the wake of understanding different circumstances related with the patient. There are various sorts of medications, they make different side impacts. For instance, calcium channel blockers can cause watery feet. Taking expert inhibitors can cause HAC, increment potassium. Diuretics might cause salt consumption. Beta blockers can aggravate asthma. So it is vital to counsel a specialist to realize which medication is reasonable for you. Try not to begin taking that medication yourself in the wake of paying attention to the guidance of individuals around you saying as much as is fine by taking that medication. Not all meds can be taken during pregnancy. Thusly, to have a kid, you should illuminate the specialist ahead of time. Let your primary care physician know if you have secondary effects from any medicine. He could change. In any case, pulse medicine ought to be taken constantly. Not that you will stop when you gain influence. Notwithstanding, at times looseness of the bowels, heaving or lack of hydration, viral fever or contamination, like dengue fever, sepsis, can cause circulatory strain to drop. Then the specialist can briefly stop the medication.